Hello, my name is Paolo Constantine and I will talk about thyroid nodules. First of all, what is the thyroid gland? The thyroid gland is an endocrine gland that secretes two types of hormones that are thyroxine or T4 and triiodothyroxine or T3. It is a butterfly-shaped organ located in the base front of the neck and it has an important role in the metabolism of cells. It's a little video that explains it furthermore.
The thyroid gland is located in the front of the neck, just below the thyroid cartilage known as Adam's apple. It is composed of two lobes on either side of the windpipe. Despite its small size, the thyroid gland has an important task. Thyroid gland produces hormones, which are important for the growth and energy metabolism of the body. The production of thyroid hormones is controlled by another hormone called the thyroid stimulating hormone, or TSH. TSH is secreted by the pituitary gland in response to the stimulation from the hypothalamus in the brain. The thyroid needs iodine out of nutrition in order to produce thyroid hormone. There are two primary thyroid hormones produced by the thyroid gland: thyroxine, also called T4, and triiodothyronine, which is also known as T3. The numbers 3 and 4 found in their names indicate the number of iodine atoms in each hormone. T4 is inactive and is converted by the body into its active form, T3. Thyroid hormone is transported by the blood to the tissues of the body, where it acts. Thyroid hormone plays a key role in all processes of the body, specifically in the growth, development, and energy utilization. Deficiency of thyroid hormone causes delay.
Okay, so keeping this in mind, now I'm going to talk about the thyroid nodules themselves. Thyroid nodules are an abnormal growth that form a lump within the thyroid gland. Most of them are non-cancerous, however, they require some evaluation, medical evaluation. So here's another video.
Thyroid nodules are areas of excess growth within the thyroid gland, and they're pretty common. Up to 30% of the population will have at least one thyroid nodule, and in women especially, by the age of 50, 50% of women will have at least one thyroid nodule. So they're very common. Thyroid nodules can have cancer. Oftentimes they don't. Most of the time, thyroid nodules are benign. In general, any nodule greater than 1 centimeter in size should be biopsied to determine a malignancy risk. In order to do that, you need to have a fine needle aspiration biopsy, which pulls cells from the nodule itself. The needle used for the biopsy is smaller than the needles that we use to draw blood. Patients generally describe it as a small poke or a pinch through the skin, and then you can feel pressure as the needle is actually passaged through the thyroid nodule. Generally, it's very well tolerated. Oftentimes in the community, when you're determined to require a thyroid nodule biopsy, you're referred to...
Okay, so how do I know if I have thyroid nodules? As I said before, there are some exams that should be addressed by doctors. These are the following. First of all, a physical exam which consists that the patient swallows so that doctor can feel its thyroid gland. The next one is a thyroid function test, which tests the T4 and T3 blood levels. The next one is the ultrasonography, and the last one is fine needle aspiration biopsy. Both of them, the last two, they are specially used in order to test if the thyroid nodule can become cancerous. So here are two videos I'd like to show you.
This video demonstrates how to set up and perform an ultrasound scan of the thyroid and parathyroid glands. Equipment required includes the following: an ultrasound machine, a selection of transducers, an examination table, positioning aids such as pillows or sponges, an ergonomically adjustable chair, acoustic gel, examination gloves, bed linen and towels, and a sonographer's worksheet. Select the appropriate transducer for the thyroid examination. Select the standard preset for thyroid and parathyroid sonography. This may be listed as small parts in some machines. Select the appropriate setting for a thyroid scan. Explain the technique of swallowing to the patient as it will be done during the ultrasound procedure. Ask the patient to lie supine on the examination table. Make the patient comfortable. Sit or stand on the patient's right side with the ultrasound machine to the left upper end of the examination table. Place a sponge, small pillow, or rolled towel under the patient's neck and shoulders. Turn the patient's head away from the side being scanned to increase the visibility of each lobe of the thyroid. Expose the neck and apply gel to the anterior neck region from the sternal notch to the mandible. Select the high-frequency linear broadband transducer. Confirm the correct transducer selection preset. Perform a survey scan of the neck and make the necessary adjustments to the machine settings to maximize image quality. Once complete, proceed to scan the thyroid and parathyroid glands. Place the transducer over the anterior neck area, slightly off the midline, in the transverse plane. Manipulate the transducer until a suitable image of the thyroid is obtained. Slide the transducer systematically superiorly towards the mandible and assess the medial aspect of the thyroid. Then slide the transducer inferiorly towards the clavicle and assess the lateral aspect. Continue moving laterally until the entire thyroid lobe is visualized and the common carotid artery and the internal jugular vein are clearly identified. Freeze the image. Annotate the scan plane, patient position, and structures identified. Measure the maximum width by placing the calipers on the medial and lateral aspect of the widest part of the thyroid.
It's very important to get it checked.
You can do a self-exam at home to see if there's any irregularities. Doctor, why don't you come over here and you can show people a little bit of what we would do at the office.
Travis, in a normal thyroid gland, which is only 25 to 30 grams, and you see this is a normal thyroid gland, it's small, it's about 3 centimeters by 5 centimeters, so it's hard even for a doctor to detect it unless there's something abnormal, whether it's too big or it has lumps on it.
So the good news is if you're going to do this exam at home, you can take a mirror, hold it to the side, drink a glass of water, extend your neck.
Now what we want to do is watch our Adam's apple as we swallow, because that thyroid gland is intimately connected to the trachea and the Adam's apple. So as he moves,
That's my Adam's apple.
Adam's apple is right here, and that gland, and I can't really feel it or see it in somebody like Travis, which I would expect because he's lean and his thyroid is of normal size. If he was to come into my office, I would also examine him from the back like so. And then the other thing I would do is I would have him turn to one side, and then that puts this nice muscle, he has sternocleidomastoid muscle, under stretch, which also pushes out that thyroid gland right there, which in his case is perfect.
Okay, Doc. So if you do see an irregularity at home, whether you're shaving or you're doing the test I just did where you swallow and look in the mirror, you wanted to get it formally checked out by your doctor.
Right.
And if they're worried and they can't palpate something, obviously they'll order an ultrasound, they'll do the thyroid function studies and figure out if everything's okay.
That's right.
So you don't know if you don't get it checked out. Great question, Rebecca.
All right. Now, how does this affect Ecuador? I found a study made in 2015 which showed that 94% of the patients were female. 30% of the patients were between the ages of 41 and 50. And 59% of them were benign, of the nodules were benign. Now, will I have thyroid cancer? Well, worldwide, it shows that 95% of the thyroid nodules are just benign. They're adenoma, thyroid cyst, Hashimoto thyroiditis. These three are the most common. However, cancers usually come in the form of the dominant solitary nodule, and they are usually presented by males between well, which age less than 20 and more than 70, and it always either thyroid nodules or thyroid cancer that requires surgery. Here's a little video.
Thyroid cancer symptom. Though, people may go into the doctor because they notice the following symptoms and signs. 1. Lump in the neck. Not all thyroid nodules are big enough to cause a noticeable lump. Some people, though, may notice a lump in the front of their neck. You may be able to see it, or perhaps you can't see it but you can feel it. Other people may notice a lump in your neck when you swallow. The most common way that a thyroid lump, and potential thyroid cancer, is detected, however, is when a doctor performs a thyroid exam and feels your thyroid. 2. Swollen lymph node. Swollen lymph nodes in the neck are another symptom of thyroid cancer, a symptom not related to thyroid nodules. Thyroid cancer can spread to the lymph nodes, which are scattered throughout your body to help you fight infection. The lymph nodes in your neck, you can feel them under your jaw, become swollen when you have a cold or sore throat. 3. Hoarse voice. Your thyroid gland sits just below the larynx. A thyroid nodule may be pressing on the voice box, causing hoarseness or voice changes. This is an uncommon way that thyroid cancer is detected. 4. Difficulty swallowing or breathing. The thyroid is on top of your trachea, the windpipe. A developing thyroid cancer may put pressure on your trachea, making breathing more difficult. Your esophagus is below your trachea, so again, a developing thyroid cancer can cause trouble swallowing. 5. Neck pain. Pain is usually a clue that something in your anatomy isn't working quite as it should. If you have neck pain that lasts longer than a few weeks, you should make an appointment with your doctor to figure out what's causing it. 6. Throat pain. Similar to neck pain, if you have throat pain that won't go away, you should go to see your doctor. It's a possible symptom of thyroid cancer. Thanks for watching. Subscribe us to get more help.
Okay, so in conclusion, we can say that it is unlikely to have nodules and it is unlikely to have cancer. Thyroid cancer. However, a checkup is suggested just to be sure. Thank you for your attention.